Before you start watching this, I'd really appreciate it if you click the subscribe button below. I'm trying to help as many people as possible, and if you hit the subscribe button, you will also help people because then people will be able to find this video. So what we're talking about today is hip pain in pregnancy. Now, most of the hip pain in pregnancy comes from lying. So you'll find that the advice is when you're sleeping to lie on your side. But as you can see from me lying on my side, this is the highest part of me, which means the most gravity is falling down into this hip. This is where the most amount of pressure is. And so as it falls down, there's a lot of pressure on this bottom hip. That's the first thing. The second thing is that with the slope in the leg, this bone is pulling on this hip socket. So this hip gets a little bit sore. This hip gets most of the soreness, but this hip doesn't get a rest, which means that when you flip over in the middle of the night and lie on the other side, this bottom hip was the hip on top, which had been pulled on. It's now instantly sore and doesn't last very long with this pressure. The really good thing is that there's a very easy solution to this, and the solution is to pop something in between your legs, which a lot of people will probably already know, but what most people don't know is that the most important thing about popping something in between your legs is that this top bone, so your top leg bone, also called your femur, is parallel to the bed or to this bottom leg. So at the moment, with this bolster in between my leg, you can still see this is still just slightly higher. Yep. So there's still a little bit of pressure on here. And I am lying on a hard ground, but I can still feel it in this bottom hip. So I would see if I can find something a little bit fatter. Now I'm still using the same bolster, but I've turned it onto its big side. So now you can see that this is flat. Because this is flat, the gravity is no longer only falling down into this hip, we're falling all the way along there. So the weight is distributed. There's now some weight onto this thigh, a little bit of weight in through the knee and the lower leg. The other thing is that when this leg is parallel, it's no longer pulling on this top hip joint. So this is getting a proper rest. I would actually recommend that you either get a spirit level, or if you don't have a spirit level at home, that you get your phone and download a spirit level app. It shouldn't cost you anything. Set yourself up in bed, get a couple of different pillows, towels, blankets, whatever you have lying around. Work out exactly what you need to make this dead parallel. It takes a little bit of effort, but once you've sorted it out, you can use the exact same thing. So if I was doing this, because this bolster is going to squash down, and when I was asleep, I'd probably end up on the flat side anyway, what I would do is I would grab this bolster and then I'd grab something like this blanket or a pillow or something like that. And there we go. That's ideal for me. Everyone's a little bit different, and you can't go on whether you think you have wide hips or narrow hips, because it's not really the size of out here, it's the size of these joints in here. When you collect exactly the right props to put in between your legs, you're going to grab a pillowcase and you're going to pop the whole thing in a pillowcase. That way, when you flip from one side to the other side, you're only moving one item. If you don't have a pillowcase, so say for instance you're using a big bolster like this and you don't have a pillowcase that will contain these two items together, you can always use an old towel and some duct tape, but it's really important that it's all one thing, because flipping from one side to the other side when you're pregnant is hard enough, let alone trying to flip multiple items at a time. So that's the first thing. The second thing, because I know at some point you're going to ask me this or to struggle with this, if it's winter, quite often women are happy to have all of their cushions and everything in between these two legs. Yep, up nice and close, keeps you nice and warm, very snug. In summer, too much blankets and cushions just add to your body heat. Plus, you're already pregnant, and so your body heat is probably a little bit higher than normal anyway. Whatever your cushions, bolsters, bits and pieces are, in summer, you might want to think about measuring it so that it's in between your shins. That just gets it a little bit further away from your torso and isn't going to make you as hot. Now, if I pop it up in between my legs, up in between my thigh bones, yes, I've still got a little bit of an incline. If I come between my knees, it's probably roughly the same incline. If I come a little bit more between my shins, now I've got an even bigger incline. So I would think about whether it is summer or winter, whether you're going to want to hug everything in nice and close, or whether you're going to want a little bit more space, and I'd measure from that setup. Similarly, if you're the kind of person who likes to sleep with this bottom leg out long and this top leg bent over here, that's a whole different curve or kettle of fish or height thing that you need to take into account. So if the thing is between your legs, it will not need to be as thick. You can see there's just a little bit of a slope from my hip down to my knee here. If your thing is on the ground and your leg is on top, there's now a really big slope down here. So I would potentially need two bolsters. Even my bolster and my blanket here is not actually going to be enough for me to get rid of that slope and that pull on the hip. Okay, so set yourself up, but one rule is get a spirit level. Make sure that that top femur or that top leg bone is parallel. It'll make all the difference. If that doesn't work, so I would just start with that, because the next one can be a little bit of a hassle. It's worth learning, but it can be a little bit of a hassle. So if you've had a couple of nights and you've tried sleeping with something between your legs and that something is parallel and it still doesn't work, grab yourself a blanket or maybe a towel and come into what we call a three-fold. So a three-fold is 3 deep. So I'm folding a third this way and then a third back this way. So I have a nice skinny blanket. We then take a third here and we fold it this way. We take a third here and we fold it this way. So if I just hold that up for you, my fold now looks like a horseshoe. Okay. What that means is that we have one side of the horseshoe here that's a bit more supportive and will lift up, one side of the horseshoe here that's a bit more supportive and will lift up, and a hole here. This hole is for your hip joint. So if I come into a kneeling position, the widest part here, where my leg attaches into my torso, that would be my hip joint. So I would take this horseshoe shape, I would take my hip joint and I would put my hip joint into that hole, and then I would come into my side lying position and I would put my cushions and blankets in between my leg until this top leg is horizontal or parallel. Some people like to have their horseshoe shape with the bump facing forward. That can be a little bit supportive through the belly, especially if you angle it slightly so that your horseshoe is in the direction of your belly here. Can give you something to lean against. Other people like to have their horseshoe so that their bump is at the back. And again, they tend to be more of the people who like to feel a bit supported through the back. So maybe they like to lean back, or they just don't like a restriction at the front here. It is a little bit of a hassle, this one. And what we aim for you of a night time is for you to get a good sleep. So the more blankets and bolsters and complicated items and bumps and things, the more you're having to wake up more thoroughly in order to rearrange everything. So the biggest problem with this one can take a lot of pressure off that bottom hip, but if you kind of roll a little bit in the night and then you slide down a little bit, and then at the moment my belly button is in line with the dip and my hip is straight on that bumpy part. So this is actually making my problem worse. So I would just start with something in between your legs, top leg parallel, have a couple of nights, see if that doesn't help with the hips. If that doesn't help and you really need a night where there is no pressure off, try this horseshoe shape. The other thing about the horseshoe shape is it doesn't have to be just for hips. You can pop anything into that horseshoe shape. So if you're getting numb arm, you can actually pop your shoulder in this way, which can take a little bit of pressure off your arm. Bottom, anything really that you like. So that's going to help with 90% of the hip pain in pregnancy. It might be that, you've fixed the sleeping, but we're still getting sort of achy hips, particularly if you've got a job that's a lot of standing, or you're doing a lot of walking, or you've got a toddler that you're running around after, and you just kind of can't get off these hips. Then I would probably recommend that you go for a massage, get an osteo treatment, have somebody have a look at it, and also to do some stretches, particularly if you're in your really later stages of pregnancy. So if you're in your later stages of pregnancy, the pelvis is designed to expand. Ideally, in the last couple of weeks, the head is dropping down into the pelvis, nice and low, getting ready for birth, and it doesn't matter what type of birth you're having. This is happening anyway. The baby is dropping down into the pelvis, and that dropping down of the pelvis is putting pressure on the pelvis, and the pelvis is spreading. Okay, it's not a lot. I know my hands are coming like this. It's not like that. It's like millimeters. Yep. But what happens is you have glute muscles that attach onto your hips and then come in this way. And then your hip bones are spreading out this way. So your bony pelvis is expanding, but your muscles are pulling back this way. And those muscles attach onto your legs. So as your pelvis is expanding, the muscles are actually, they're not getting tighter, but they're getting tighter relative to the space of the pelvis. Yep, so the pelvis is expanding, the muscles are pulling tight, and that pulls often on the hip bone. There's a lot of things that you can do for that, particularly if you're later stages of pregnancy. You really can't go past coming down onto your elbows and spending some time in this position, doing some circles, doing some rocking backwards and forwards. All of this is going to help to open through the pelvis a little bit. You also can't go past having your partner do a little bit of a massage in and around those glutes. And I would suggest that rather than a massage, more like 2 thumbs and just poke, release, poke, release, poke, release, poke, release, poke, release, all over the glute muscle. So just dig in, dig in. You can always say to your partner, yep, more there, less there, a little bit harder, a little bit softer. It's often a lot easier just to communicate and to coordinate this than to coordinate an actual massage, especially if you don't do massage. And then lastly, one of my favorite stretches for helping to create some space through the pelvis is to take your right leg and take it over to the left side of your bottom so that your right knee is facing as far forward as you can manage. The next thing we aim to do is we aim to take this left leg over to the right side. Now, I'm not pregnant and I've got 20 years of yoga teaching under my belt, so it is easy for me to stack my knees up on top of each other. You may not look like this, okay? It doesn't matter. You might find that you can get this leg down, but this leg looks like this. As long as you're feeling a stretch or an opening sensation through the back of your body and maybe a stretch through the glutes or the hamstrings, I'm happy. If you do have the flexibility to get your leg over, but you don't have belly space, then what you want to do is you want to sit yourself up onto something. Can be a book, can be a yoga block, can be a cushion or a blanket, rolled up towel. That'll just give you some height. It won't make this stretch any easier. It'll just give you some height to work with. If you need to make the stretch harder, you can walk your hands forward or you can open your legs out into more of a horizontal position. The aim with this one is to create space through the back of the pelvis. So this is a good one preparing for labor if you're having that kind of birth. But it's also a really good one for making space in those glute muscles that are pulling on the hips. The reason this works is because this leg is headed in that direction, this leg is headed in this direction, which means that the tissues are being pulled like that. So there's lots of space around. Ideally, hold it for 1 to 2 minutes. If this is comfortable, we then ideally would like to do the other side. If that's too much for you, just do one side. But next time you come to sit down, maybe we could try the other side. So I hope you found that helpful. Again, if you didn't do it at the start, please, 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 please subscribe. This is all of the information that I find myself repeating over and over and over again. So I'd really like to be able to just send people this video. And the more people that subscribe and the more people that like the video, the more and the easier it is for people to find it. So more people have this information and are able to help themselves at home. Thank you. Thank you for listening to me. Namaste.